One of the big things for us is that in 2014 we lost over 200 people to overdose deaths. These are preventable, and since we've seen an increase in the usage of Narcan by emergency personnel, including police, fire, rescue, ambulances, and emergency rooms, over 1,300 doses of Narcan were administered last year through November. That's 1,300 lives saved. An overdose is a preventable death, and no one should be fearful of being prosecuted for saving a life.
And that's what's happening now. People are fearful because if somebody starts to OD in front of them, they say, oh, wait a minute, don't call because I don't want to go to jail.
Correct. And we did have an instance last year of a woman who had called in an overdose and was picked up for, I believe it was a parole violation as a result. And she later died in November of last year. And people that are in recovery matter. We vote. We work. We pay our taxes. We're just as important. We're just as important to this economy, to this state, as everyone else.
I agree.
And to see people, I believe last year, the age range of people that overdosed was from 15 to 65 years old across 30 communities within the state. It doesn't discriminate by color, by gender, anything like that. And it's preventable.
Well, this is really nice. How do you like the turnout?
I'm actually, given the fact that this is a very snowy, cold, raw day, I'm very impressed.
Yeah, I am actually too. I think half of this would have been impressive, and I think you doubled my expectations by a lot.
Thank you so much. Yeah, I'm very grateful to be here. I'm also a person in recovery, and this matters to me. Actually, one of my closest friends, we were living in a recovery house together, and he overdosed. And I didn't know about Narcan. So I found the house manager who administered Narcan, but he almost died. So for me, what I did after that was I started to get involved. I'm certified to administer Narcan. I carry it with me. You know, it's funny, I work at a local company, and I've gone outside and I've seen Suboxone wrappers on the ground. You know, so it doesn't discriminate.
No, it does not.
You know, and Suboxone is a medication used, and it's used responsibly and properly and that kind of thing. But for me, even things like that expanded my view. Addiction's not just the people in Kennedy Plaza. You know, addiction, there are neighbors, there are friends, there are family members. You know, and it's so important that we remove that stigma.
Well, it's true, because I know that a lot of people think drugs is just like this inner city problem. But to be honest, I mean, when you look at it's not the same for every race, every economic area. It's not. It really doesn't.
Exactly.
But it is a perception of it. It's just. You know, out in the bad parts of town.
It's an inner city urban problem, and we're seeing kids that are younger and younger coming into recovery with substance abuse disorders. This year we've already had 2 overdoses. One was a young man I knew who was 22 years old.
Now, when you say a person overdoses, you do mean they die, right?
Overdosed and died.
You don't to die, right?
Correct.
So it's been 2 already this year.
2 already this year, and that's 2 too many.
And now, do you know there's been Narcan administered too, so it could have been more, right?
There could be more, and that's the other thing about the Narcan statistics. We know what's been given by emergency personnel and by hospitals. We don't know how many cases have been done, like in a home setting or that kind of an environment.
So a person like you who's basically accredited to do that, you don't know if you've used it or not.
Correct. There's no accounting for those figures, but there is one thing that's really important about Narcan is even though Narcan is used to reverse an overdose, it's not a permanent reversal. So someone who's gone into overdose can be brought back with Narcan, but needs to seek emergency treatment immediately because the drug will wear off and the overdose will start to kick in again.
So you still need to get them to the hospital.
Correct. So they all need.
And so that's also important to know, because if you're in that position, someone says, oh, you're not doing good, you want to know really. And it's also important that people be allowed to then call that person in and call on rescue, not be subject to arrest.
Exactly, and it's very important. And when we start talking about, you know, people being arrested, for me, that's social justice. You know, that we can't arrest people for saving our friends, our families, and our neighbors.
We have to at least give them out for that one, right?
Exactly.
that's got to be it.
And one of the amazing things that we've seen too is in people that have gone into the hospital rooms and the emergency rooms, there is a new program called Anchor ED, which is a service through Buddha as well as the Providence Center and the Anchor Recovery Centers, where on weekends in 5 hospitals in the state, if they have an overdose, they can call a recovery coach, which is a peer-to-peer support advocate. And at that time, when someone's overdosed, they tend to be most receptive towards looking for treatment and options for their substance use disorders. And so far, we've seen tremendous success with this. We've seen 89% of people seen by recovery coaches in emergency room settings look for recovery solutions. So it's all part of a continuum of services.
That's really good. It would be nice too because you can take these people out of the criminal justice system.
Exactly.
Theoretically save money. If we actually looked at it that way.
And actually, one of the largest populations that are vulnerable for overdoses are prisoners re-entering, because oftentimes, if you've been in prison for 6 months, 9 months, and not using any substances, if someone gets out and they pick up a substance, they may go back to what they were doing 9 months ago in terms of amount, and that can cause an overdose.
I was just hearing that. Now, this is something that I just learned recently too, because I was doing some research ahead of this, but somebody told me that what happens is you lose your tolerance.
Correct.
And so you think you're still at this higher dosage, and you find out you don't have it, and so that'll just kill you.
Right, exactly. And when you think about calling in 911 for an overdose like that, well, what happens if you call in that overdose and that person gets arrested for overdosing? I mean, it's a whole slippery slope.
Oh, it is,
the most important thing, though, is to save their life, is to call it in regardless and then deal with the outcomes.
And getting revamping the drug laws can come later.
Exactly.
It's definitely on the agenda.
And today it really is about this Good Samaritan law, and it is about the number of lives we've lost. There have been more people lost to overdoses in 2014 than murders and car accidents combined. It is a health epidemic, not just in Rhode Island.
Have you had any response from the General Assembly on this at all?
No, this is our first action of the year, first day that they're in first day that they're active, but it is a priority for RICares. And persons within the recovery community, and actually all of our communities. A lot of people, we have letters prepared for our legislators that we will be going in and delivering and letting them know we're registered voters. We want this on your agenda this year. Recovery matters.
At the very least, don't let this program go away.
Exactly.
Re-up it on any level. Re-up it. And improving it would be great, but re-up it.
And actually, currently, only about 20 states have Good Samaritan laws within the country. And they're all done in varying degrees. I mean, New York State is an example where they do have Good Samaritan law, but it's like Rhode Island's, where for parole or probation, you can still be arrested for it. They also do a Narcan distribution program. However, New York law requires, I believe, that you have an MD, nurse practitioner, LPN, or other medical physician's assistant dispense the Narcan. Whereas here in our state, we've got programs like Pony over at Miriam. We've got a lot of community groups where they're hosting drop-in training sessions where you can go in, you can learn how to use Narcan, you can receive a prescription for Narcan, which you can use. You can get Narcan from any Walgreens pharmacy.
And just go out and use it if it comes up.
Exactly. And Narcan, again, it's not just for addicts; it's for families and loved ones. And the use of Narcan, I've heard some stirrings and rumblings that if we can use Narcan, we're going to encourage people to use more. It's not true.
It's an
old myth, and overdosing and seeing someone you love in the midst of an overdose is one of the most horrifying experiences ever, because there's a sense of helplessness. And Narcan relieves that sense of helplessness.
At least stabilizes them long enough.
Stabilizes them long enough to get them the help they need.
And now, because I don't know how this works, this is an injection?
There are 2 forms. We currently have injectable forms available, and there are also nasal sprays available. I think a lot of the police departments and EMTs do the nasal. A lot of the community organizations do the cost, are distributing the injectable form. But it's very simple to administer. It goes into a thigh or an upper arm, and it only works on opioid overdoses. Some people are afraid, well, what if someone's having some other kind of overdose? It's not going to impact them adversely, from what the medical literature tells us.
Or if somebody you mistake a heart attack or something. It's add to the problem.
Correct. It's not going to add to the problem, and if anything, it'll keep someone breathing long enough to get to a hospital, and then if they're seen by one of the recovery coaches, then maybe it's enough to get them in recovery. My mother used to always say to me, where there's Where there's life, there's hope.
Yeah.
And that's what Narcan does.
This is a great. And how long are you going to be here?
We're going to be here till probably about 3:30 or our feet freeze.
Okay, 3:30. Okay, good. All right.